announcement before we start. One of the comments I was going to make here was it's really, really sort of intimidating to speak when your boss is in the room. But then when your boss tells you what to say, it's a lot easier. So this is Colorectal Cancer Awareness Month. So I know it's not really table talk, but think about it because it may save a life. Thank you. And thank you, Jeff and Kathy, for your kind words and your incredible support of VEPS. Dr. Pino, colleagues, friends, family, and family people. I want to thank all of you for being here and for your tremendous support of MD Anderson and the volunteers who serve. All right, I'm sorry. Can you hear me now?
Yeah.
Okay. Great. Can you hear me? Jeff, the attendance here today is really a testament to you and your family's devotion and support of this great institution. I know your father will be most proud. Albert Schweitzer once said, the purpose of human life is to serve and to show compassion and the will to help others. When asked to speak at this function, my first question was, why me? Second question was, about what? Having given so many talks about MD Anderson's transition to a new electronic health record and the tremendous change in our culture that that's going to require, I thought that would be something. I just gave one of those talks again this morning. But in another vein, the patients I care for with cancer have primarily gastric cancer and cancer of the appendix, as Jeff mentioned. Yes, you can get cancer of your appendix. And some of you are probably thinking, boy, I'm really glad I got my appendix out. And a few others may be thinking, yeah, I'm going to call the surgeon and see if I can get it out now. But before you do, think of it this way. The federal government defines a rare disease as one that afflicts fewer than 200,000 people. Each year in this country, approximately 500 people develop cancer of the appendix. So this puts into a category that's termed an ultra-rare disease. You would be more likely to win the lottery, if you played it, than to develop this disease. Nevertheless, this disease can cause significant morbidity and mortality, and the disease course typically tracks out over years. I've been to prior VEPS functions, and I've heard scientific talks, and so that does seem to be the safe route to go. My original background is chemical engineering. If Jeff had had full time to give the introduction, he would have mentioned that for sure. I was given a very strict timetable here, so. But one of the studies that's important in that is thermodynamics. And entropy is based upon the second law of thermodynamics. And some of you are shaking your heads, what's that all about? Well, part of this is something that says that entropy says that everything goes to the sameness, or chaos. This is based on the second law. And part of the chaos theory is something that you may have heard of. Lorenz's theory of sensitive dependency on initial conditions. I would like to discuss this theory as it pertains to MD Anderson and how and why we're here today. MD Anderson is a complex, multifaceted, and intertwined living quilt, if you will. That quilt started in 1941, though you could easily argue that the roots of that were far earlier. MD Anderson started with but a few pieces. Our volunteers were one of those pieces. At that time, a young man from Paris, Texas, Ben Love, was preparing to serve his country in the Army Air Corps in World War II. He survived numerous flights over Europe, while many of his colleagues did not. That young pilot settled in Houston to build a life and raise a family. Over the years, many pieces have been added to that quilt. In 1973, Ben joined the Board of Visitors, though I'm sure his relationship with the institution started far before that. I have every confidence that during one of his visits to the institution that he had a positive encounter with a volunteer, and he likely knew people who were volunteers at MD Anderson. Our volunteers come from all walks of life. All pieces of the quilt are important. Some pieces fade over time. Others threaten the integrity of the quilt and must be repaired, removed, or replaced. But all add to the rich tapestry that is MD Anderson. When you look at a quilt, you first notice all of the pieces, and the colors, and the shapes, and the sizes, and the patterns into which they're organized. But as you look more closely, what truly makes a quilt is the intricate stitching that holds the batting inside. This stitching provides a subtle but vital texture that helps hold the quilt together and provides a balance to it. In 1976, a young urologic surgeon, Andy von Eschenbach, left Philadelphia and joined the faculty at MD Anderson. He had trained at Pennsylvania Hospital, the first hospital in our nation. This hospital was founded in 1755 by Ben Franklin and Thomas Bond. Although it's the nation's first hospital, it's not really that well known out of the Northeast. As Andy's career progressed here at MD Anderson, he became a department chair and he became friends with Ben Love. I entered my surgery training at Pennsylvania Hospital in the early 1980s. This happened to also be the hospital I was born in. And when I would see patients, we would talk and I would say, yes, haven't got very far, I was born in that building across the street. I was uncertain as to what path in surgery I might take. Late in my residency, I found myself drawn to caring for cancer patients. For whatever reasons, this dreaded disease, or more accurately, these many diseases, afflicted the old, the young, the wealthy, the poor, irrespective of their color of their skin, marital status, orientation, or personal beliefs. You may have seen the YouTube video about the honey badger. Well, similarly, cancer doesn't care. As a chief resident at Pennsylvania Hospital, I performed a lymph node biopsy on a young man in his early 20s. He had already had a bone marrow transplant here at Anderson, and unfortunately his lymphoma had recurred. When informed of this, his first words were, "I'm going back to Anderson." Well, as you might imagine, being in a city with many fine medical centers, University of Pennsylvania, Jefferson, and others, I was taken by quite a surprise. We spent the better part of the next hour talking about his situation, but also about this place in Houston. I'd read a few scholarly articles from Anderson, which was the newest of the big cancer centers, Memorial Sloan Kettering and Roswell Park being the others, predating it by 50 years or more. And I was hoping to go to one of those centers for my clinical training. Unfortunately, or maybe perhaps fortunately, the match for those positions had already passed. As he related his experiences to me, the passion in his voice had a profound impact on me. He spoke of how the people here cared for him, not of the high-tech treatments he received, but of the compassion he felt. This compassion came not only from his doctors and his nurses, but also from those who cleaned his room, drew his blood, and the volunteers who came to his room and provided a few simple things, a toothbrush, and Afghan. But those things came with something more, far greater, their time and caring. From this conversation, I became curious about this place in Houston, and I was able to secure a research fellowship and came here in 1988 for 1 year. Richard Martin, one of the greatest gentlemen in all of surgery, was at this time nearing the end of his spectacular 42 years career as a surgeon at MD Anderson. He had also initially come for 1 year. I became quickly enamored with this place and its mission. Its purpose resonated deep within me. Like so many others who have come here, I quickly realized that caring for cancer patients was my calling. And this was the place. I was able to secure a clinical fellowship spot, and my plans of heading back north changed. Later, I found out that Dr. von Eschenbach, whom I barely knew, had played a pivotal role in my selection for that fellowship. Subsequent to training, I joined the faculty at Anderson, where I've stayed ever since. This place has, over the years, seeped into my soul. They say you should not love an organization or an institution, but I, like so many others here, do. We see this place as a family. And like a family, we may not always see eye to eye, but we have a common unseen bond that holds us together. This bond is forged by a single focus, cancer, and caring for those afflicted by it. By your presence here today, you are all part of our family. 10 years after my starting on staff, Dr. von Eschenbach introduced me to Ben. I always tried to call him Mr. Love, but he would not have it. I became fortunate enough to be able to call Ben my friend, and we would have conversations that ranged from Napoleon to finance to healthcare to the nature and meaning of life. We have made tremendous strides in healthcare technology, but I believe there's more, much more to this profession, to this calling. In the Garden of Eden, there were two trees that were named. the tree of knowledge, both good and evil, and the tree of life. The story of Adam and Eve is a familiar one, and how they ate from the tree of knowledge. And over the millennia, we have seen how people's knowledge has increased and is now growing exponentially. This knowledge comes with a propensity for both good and evil. However, even knowledge that is good can be harmful if we do not have the wisdom to apply it wisely. In our society, there's often an assumption that we must always do something. This is most apparent in caring for cancer patients. We have tremendous technology at our fingertips, and with the unlocking of the human genome, ever more powerful therapies are being developed. Some see this as analogous to finding the tree of life from the Garden of Eden. This, many believe, may be a pathway to dramatically changing the duration of our lives. I would argue, though, that the tree of life is more about our humanity. It is about our connectedness, how we interact with one another, how we care for one another. Successes are easy to share with patients and their families. It's when sitting and holding a patient who is suffering the side effects of their treatment or the complications of their disease, or telling them their cancer has recurred, or finding out that their latest treatment has failed, that our compassion is most needed. A few years ago, I cared for a young man, 32 years old, who had advanced melanoma. 5 different therapies had all failed to have any impact on his disease. He was relentless. As we were discussing whether to provide simply supportive care or an emergency palliative operation that under the best of circumstances would result in his having a permanent colostomy, he made the observation, everyone wants to get to heaven, it's just no one wants to die. Through having the privilege to care for so many patients, far too many of whom are no longer with us, I've learned many important lessons. The joy of waking up each day and seeing the world around us is a simple yet profound opportunity we each have, but all too often take for granted. Ron Bliss, who had spent 6.5 years as a POW in Vietnam, referred to it as being on the right side of the grass. What people want, what people need, and I believe what people deserve, is someone who will listen, someone who cares. In the operating room, we have laparoscopic surgery, robotic surgery, both of which take the surgeon further and further away from the patient. In fact, using robots, surgeons in New York famously removed the gallbladder of a patient in Paris, France. We have the ability to remove a person's gallbladder through their mouth without ever making an incision on their abdomen. As our technology increases and the ability to operate on someone without even touching them expands, the significance of human contact becomes all the more important. Our role as physicians, I submit, is putting all of this technology and science into perspective, giving it a human context. I was recently asked about a drug someone was taking for cancer of the appendix. That drug was approved because it increased the time to progression of disease by a single week. What did not seem to garner the attention it deserved was a reason that this prolongation occurred was that the patients were so sick from taking the drug that their tests had to be delayed by a week. I believe that as we increase the technology of medicine, we must also increase the touch of medicine. When someone is in need, there is nothing more powerful or more comforting than the compassionate touch of another person. The touch of a caring hand can alleviate pain, it can assuage fear, and it can convey more information than pages and pages of the written word. Recently asked about my favorite place at MD Anderson, my immediate response was the operating room. It seemed easy. My reasoning was that the focus of everyone there was on the patient, and the impact was both immediate and profound. However, that was a bit of a simplistic answer. It's really part of the continuum of care that is so important. Coming out to the surgery waiting area to speak with families is part of that continuum. It may be filled with good news and joy, but more important is how difficult news, or an outcome less than we desired, is conveyed to the family. While I may visit with the family for 5 or 25 minutes, it is the efforts of Marcia and me, or Sally and Lucilla, Mary Van, or Tom and his wife Maureen, who so often smooth the path for these difficult conversations. These are some of the volunteers who help so many families while they anxiously wait to hear how their loved one's operation went. This is no easy task, as any of you have had to wait, no. They provide another measure of that human touch at a time of great need. Arthur Ashe, famous tennis player, once said, "Start where you are, use what you have, and do what you can." Each of us has a unique set of skills, talents, and opportunities. Another lesson I've learned from my patients is the value of time. Money, property, and influence are all of some importance, but time is the one thing that is the same for all of us and is constantly slipping away. How we choose to spend that time with family or friends, or work, or serving the needs of others, are all reflections of how we value this precious commodity. We cannot increase the balance sheet of time or add to the bank of time. And thus I would suggest that time is the most valuable asset we have. And this is precisely what our volunteers give. Every day, from early morning hours to late at night, scores of volunteers touch and improve the lives of our patients and their families, giving their most valuable asset. Going back to that quote I mentioned earlier, I would submit to you that our volunteers who give their time and efforts are those threads that make the quilting. They are not the first thing you notice when you look at the quilt, but they are vital to it. Irrespective of changes in technology, policies, leadership, or the world around us, volunteers provide a balance, a substance to our institution. Well, I'm sure by now some of you, probably most of you, are wondering, what does all this have to do with that chaos theory you talked about at the beginning? Well, Lorenz's theory of sensitive dependency on initial conditions is known more commonly by another theory, the butterfly effect. This theory seeks to explain how events removed by time and distance are in fact deeply connected. This theory may be best described by Dean Koontz when he said, "Each small act of kindness reverberates across great distances and spans of time, affecting lives unknown to the one whose generous spirit was the source of this good echo. Because kindness is passed on and grows each time it is passed on, until a simple courtesy becomes an act of selfless courage, years later and far away." A young Army Air Corps veteran moving to Houston is developing a relationship with M.D. Anderson, his son Jeff and Jeff's wife Kathy continuing that relationship. Andy von Eschenbach, a young man in Philadelphia with lymphoma touched by volunteers in Houston. A surgical trainee looking for his calling. The chance need of a patient. The meeting of a surgeon and a volunteer. All of these at one time seemingly unrelated, yet intertwined people and events are what have led us to today, have led us to here. Going forward, we should realize, I believe we must realize, the profound impact our seemingly insignificant actions may have. If we do not reach out, if we do not use what we have, if we do not do what we can, we will never touch the horizons and through this realize the true promise of the tree of life.